Out today. I said we can't blame any turnout on bad weather, but Terry reminded me we could blame turnout on good weather, because many people like to be out kayaking and enjoying the outdoors when it's like this. So, but thanks for coming very much and helping our People Voice to do what needs to be done. Working at Interfaith Community Health Center, I see people every day suffering from lack of decent health coverage. No health insurance, underinsured, where they have to pay the first several $1,000s every year, and then when they actually get sick, find out that it doesn't cover what they need anyway. So that happens everywhere. How many people here have had a personal experience or know someone who's had a problem with health coverage? I think that's just about everybody, yep. So I say, in this country, everyone has the right to an attorney if you're accused of a crime, and I think it's time that everyone have right to medical care. And if we have the billions of dollars that we have to fight wars in Iraq, then we have billions of dollars to put into health care. And we are paying way more than we ever should need to, because so much of this money is getting siphoned off to health insurance and pharmaceutical companies, where these executives are making obscene salaries. Abe down in Mount Vernon recently, when the no health care nuts were speaking out, stopped them all by saying, what about the waste and abuses in the health care insurance companies, when my executive of my health care company got paid $1 billion when he retired? That's just obscene. You know, there's an old quote about obscenity. It's hard to define, but you know it when you see it. I say, well, that's obscene. So right now, thank you. Right now, we know there's 18,000 Americans who die every year just from lack of health insurance. You know, 9/11 was terrible, 3,000 people killed in one day, but 18,000 every year just from lack of health insurance. And it's time to change that. That's right. Who says that insurance company profits are sacrosanct? That's right. So, back in World War II, there were limits on how much these defense contractors could make, and if they charged too much, they were called war profiteers. Well, we have healthcare profiteers. We have pharmaceutical profiteers, and they're just trying to make as much money as they can. That's what they're in business for, and it's time to take that out of the equation and put it back into healthcare for people. Right now, if we passed the single-payer insurance, we would have more than enough money, saving over $350 billion to cover everybody with good coverage that wouldn't have to be signing up and getting cut off and things not getting paid for. So single-payer is definitely the best option. I think we need to really keep the pressure on to get the best reform we can with Rick Larson and our senators. Rick Larson is he's working on some of them, but I think he needs all the support to work harder on it, okay? Because if Boeing and the military decided they needed national health insurance, it would happen tomorrow, right? How about us? We need health coverage. So we need it today, not tomorrow. That's right. We also need Medicare reform, and that's something you don't hear as much about, but here in Whatcom County specifically, in Washington State, we're paid less than half of what doctors are paid in other parts of the country for the same exact diagnosis. That's why if we just expanded straight Medicare funding into this national health insurance, it would be hard for a lot of docs to see people. If you got your wonderful national card, they'd say, I'm sorry, that's pretty low. So I think I think that's one thing that Rick Larson is getting right, that we do need to make Medicare more equitable, that you shouldn't get paid a ton of money just because you happen to live in some other state. You can make it based on the cost of doing business. That's reasonable. So keep the pressure on to Rick Larson to get him to do the right thing. I think right now it's really getting to be like the civil rights movement, and just like we're marching here, they march there back, and that's what got it done. You know, they say power does not yield without a struggle, and we need to struggle. So just like if you got a right to an attorney, you should all have the right to health care. So I appreciate you coming. Right now I got to run on back to Interfaith Health Center and keep seeing patients, because with all the state budget cutbacks, we're actually having cutbacks ourselves based on lack of revenue, because we still see people, we charge them a low cost, but you know, times are tough, and so the clinic has less money coming in. So if we had reasonable national health insurance, that wouldn't be a problem. So thanks very much for coming. Be in touch with your politicians and keep the heat on.
Thank you. Thank you.